Twins born into one of the wealthiest families in the country were never expected to begin their lives with a medical crisis. When Daniel Hawthorne, a billionaire investor known for keeping his family out of the public eye, welcomed his children, his plans for privacy remained intact, but his expectations for their future changed instantly. The boy Elias and the girl Elise were born with paralysis from the waist down. It was detected within hours. They did not respond to touch in their lower limbs. Specialists were called immediately. There was no clear explanation. The pregnancy had been monitored closely. The delivery was routine. Yet the twins showed signs consistent with spinal abnormalities. Their condition was not hereditary. It was not tied to medication or procedure. It simply existed. Doctors offered slow, cautious optimism. They said therapy might help the children build muscle tone and stimulate nerves, but no one promised movement or full mobility. Daniel accepted the information like he approached business, with strategy and control. He paid for the best medical teams to rotate through his home. His wife, Marianne, withdrew from public life to focus on learning how to care for children with mobility limitations. The mansion they lived in operated with precision, staffed by employees who followed strict boundaries. Their roles were defined, and interaction with the family was limited. Among the staff was Angela, a maid from another region who had worked in private homes for years. Her job included cleaning bedrooms, organizing linens, and maintaining common areas. She did not handle childcare and did not speak unless spoken to. She passed the nursery often, but only to replace laundry or disinfect surfaces. No one paid much attention to her movements because she never broke routine. The twins received therapy twice a day. Specialists used equipment brought into the home. Nurses managed schedules, medications, and positioning. The progress was minimal. Some upper body strength showed promise, but nothing below the waist changed early on. Daniel tracked every update. He reviewed reports and recordings. He believed oversight would result in improvement. 3 months after the twins were born, he returned home from a meeting earlier than expected. He went upstairs to look in on them without announcing himself. Their nurse was on a short break, and Marianne was resting in another room. He heard a soft humming sound coming from the nursery. He assumed someone was tidying the space. When he stepped inside, he saw Angela standing by the bassinets. She had her hands placed gently beneath the baby's feet, moving them in small, rhythmic motions. She was not lifting them or applying pressure. She was simply pressing her palms against their soles and shifting slowly, back and forth. When she noticed him, she pulled her hands away and stepped back. She apologized and explained that she had only been adjusting the blankets and noticed the children were uncovered. Daniel asked her calmly what she had been doing with their feet. She answered without hesitation. She said she grew up around relatives who used touch and massage to help children with limited mobility. She believed the sensation could be comforting. She was not trying to provide treatment. She said it quietly, without argument. Daniel asked her to leave the room. He did not raise his voice. He wrote a note in his phone to review the situation with the head nurse. He contacted the staff supervisor and asked to review camera footage before making a decision. Over the next several days, he monitored the nursery more closely. The footage revealed that Angela occasionally entered when nurses stepped away briefly. She never attempted to pick up the babies. She did not sit or linger. She only touched their feet or legs when adjusting bedding. She used the same gentle motion each time. Rather than remove her immediately, he arranged a meeting with her in a controlled setting. During that conversation, which was recorded for documentation, Angela explained her reasoning again. She said that where she came from, people believed light stimulation helped circulation in children who could not move on their own. She made it clear she did not intend to interfere with the medical team. She also said she understood if the family wanted her to stay away from the nursery entirely. Daniel informed her that any physical contact with the children needed approval from licensed caregivers. He told her the decision about her actions would depend on the medical team's review. She accepted his response. He then shared the footage and the conversation with the lead physician and Marianne. The doctor noted that while unauthorized contact was a liability concern, the motion itself did not appear harmful. Light sensory engagement, if done correctly, could support nerve response. The concern was not the intention, but the lack of communication. The physician recommended establishing clear guidelines rather than imposing punishment. Angela was informed she could continue her housekeeping duties near the nursery, but could not touch the children unless a nurse approved it in the moment. She agreed and followed the rule without issue. Daniel remained curious. He asked the therapist to track any changes in the twins' sensory responses. During a routine check, the children showed faint reaction when their feet were pressed. It was not movement but a reflex not previously recorded. The progress was attributed to the therapy schedule, but Daniel found himself replaying the earlier footage. He noticed the calmness with which Angela interacted. She never overstepped, but she seemed to understand rhythm and pressure in a way that matched some therapeutic techniques. One afternoon, he saw her folding blankets in the nursery while a nurse worked with the twins. The babies were awake. The nurse tapped their legs lightly to stimulate circulation. Angela watched without commenting. The nurse later said Angela had asked questions earlier about how pressure points helped nerve pathways. That prompted Daniel to organize a supervised discussion with the therapy team and Angela. He did not present it as a disciplinary session, but as an opportunity for clarification. During the meeting, Angela described techniques she had seen in her family and community. Some of the motions she mentioned aligned loosely with pediatric sensory stimulation practices. A therapist asked her to demonstrate with a training doll so they could observe. She hesitated, then agreed, but only repeated the small motions she had already used with the babies. Her technique was simple and low pressure. The therapists recognized elements that could be integrated safely. They decided to add a short segment of similar tactile rhythm into the twins' sessions. They did not credit Angela directly. They recorded it as an additional stimulation approach worth testing. By the 6th month, there were small signs of improvement in reflexes. The children still had paralysis, but increased circulation and tone in the legs were noted. Therapists stated that early sensory exposure, especially when combined with formal therapy, could contribute to long-term potential. Daniel had not expected any influence to come from a member of the housekeeping staff. He had built his system around credentials, schedules, and structured interventions. Yet what he observed led him to reconsider how knowledge can appear outside formal titles. Angela did not change jobs. She did not seek recognition. She continued her duties with the same consistency as before. The difference was in the household's internal communication. Daniel and Marianne updated staff guidelines to encourage employees to report anything they observed that might relate to the twins' comfort or development, as long as they passed information through proper channels. Rather than increase restrictions, Daniel created a way to receive input without crossing boundaries. There was no media coverage. No conflict surfaced publicly. No confrontation spread through the estate. The situation remained private and resolved through process rather than reaction. The small improvements in the twins were not labeled miraculous. They were treated as incremental progress tied to combined efforts from professionals and carefully monitored stimulation. The experience altered Daniel's assumptions about contribution. He maintained safety and oversight, but he no longer dismissed the possibility that someone without formal training might notice something useful. This development also showed how silence between staff and employers can limit opportunity. Angela did not push herself into the nursery to play a larger role. She acted from habit and background, not from ambition. When questioned, she was direct and respectful. The professionals chose to evaluate rather than discard her perspective. That approach allowed for progress without risk. The twins continue to require therapy and long-term support. Their future mobility is uncertain. But the early stage of their care was shaped not only by medical planning, but also by a moment of observation during a quiet afternoon in their home. Daniel did not speak publicly about the incident. He did not identify Angela by name outside the household. His focus remained on outcomes and privacy. But the internal changes he made reflected a shift in thinking. He no longer believed that expertise exists only within assigned roles. He also saw that respectful listening could prevent conflict before it escalated. The event did not turn into a story of confrontation or violation. It became a reference point for how observation and oversight can work together. The twins' journey will involve continued support, adaptive tools, and evolving care. They may or may not gain mobility in the future. What remains certain is that their development was influenced in part by someone no one expected to part.